crossways. Good. Are you ready?
Mm-hmm.
All right. I thought the best way to show you my protocol was to show you my protocol. So, what I have in my setup, I've got my clear, odorless ultrasound gel. I've got these individually wrapped tongue depressors, and then I've got my crouch shields they're made by Bausch & Lomb. You can get them from multiple dealers online. And I use this plunger, for RGPs, to put it in so that I can squeeze and release and get my plunger back out. But I use this one for RGPs to get it out so that it doesn't lose suction. It just does a little bit better job. These are pretty large shields, but they're great because they block the light so the patient's less light sensitive. I put in proparacaine, I put in 2 drops of Celluvis, and then the shields go in. Then I put a thick layer of gel on their face using this tongue depressor. And then I use my tongue depressor to hold it up against their lashes so that I have no fear of getting too close to that lash line. And that way I can butt right up against my tongue depressor. So it works beautifully. And then hold on to it because you're going to use it to scrape all the gel off and get them cleaned up quickly. So those are the basics. After we clean off the gel, then I put this purified oil on. It's fantastic, 7 oils, no preservatives, and I try to send them home with this because it's great for rosacea skin. If they are a little bit pink, if I had to really focus on an area, we might put a little bit of CBD oil on topically just to calm it down, but I don't have to do that too often. And then we rinse out the Celluvis with the Pure and Clean drops. So that's the basics in my setup. Now, as far as my tools here, I use the medium and the large head. Now, the medium one is obviously bigger than the small one, but the reason I use it is because it has more elevation off of the patient. That way I don't have to worry about the brow getting in the way. So I don't feel like it's too big at all. It works great. I'll do 3 across, 2 to 3, depending on how much space there is, and then I'll do 3 passes, at least 2. Just depends on what their situation is. A lot of times I'll do extra because it doesn't hurt at all. Now, as far as my settings, I start out with this iProX, which is my medium head, and I'll go to vascular settings, and then I'm gonna go to 18 and 18. And this is what I've been doing for the past year or so. It's worked beautifully. I try to keep my snowflake down to 1, and this is what I'm gonna use for the lids. Upper and lower, 2 to 3 passes on each lid, and use your popsicle stick or your tongue depressor on those bottom lashes. You don't need it on the top ones. Now, once I've done that, I may go ahead and work on a concentrated area of telangiectasia with the small tip, just so that I can turn it up really high and work on that focal area. But most of the time, I go ahead and get out of here, and I'm gonna switch straight over to the XL. And then when I go to the XL, if I'm doing just my limited protocol, then I'm gonna go straight to vascular, and my settings will still be in there from before. I'm gonna keep it at 18, 19 on the IPL, but especially for my women, I'm gonna jack the radio frequency up, and usually I'll max it out at 50. Unless they feel the heat and they want me to turn it down. But this is going to give them more skin tightening effect with no risk of burning them. So, and again, I keep my snowflake at 1 if as long as they're okay with it. If they're getting hot, then I can either turn either of these down or increase my snowflake. Now, this is for my limited protocol, and I'm going to go tragus to tragus 2 times. If that's all we're doing is the eye therapy, we stop there and we get out. If we're doing the full face and we're going after telangiectasia and erythema, then I'm going to hang out longer. For my telangiectasia, I'm still going to be with my 590 filter. So far, everything we've done is a 590 filter. But I'm going to increase this to about 23, 24 for my telangiectasia, and I'm going to hit it several times and try to watch for it to blanch and be slow to refill. Once you see that delay in the blood refilling that vessel, then you know that you've got it. If the area starts turning red or they're uncomfortable, then I'll back off and move on. When I'm doing erythema, then I'm gonna back way off. So I'm gonna go down to about 15, and I'm gonna use the 530 filter for erythema. 530 erythema, and back off. And this they're gonna feel a little bit more. So you may need to back off more or increase your snowflakes, but it's still very, very comfortable overall. Now, if we're doing anything else, then I'm gonna do pigmentation. With pigmentation, I just use the default settings, and I use the 530 filter. And for acne, I'm gonna use the default settings, and I'm gonna use the 480 filter. Now, out of everything I do, this is the only one that stings a little bit. So just warn the patients, and I only do the areas where they have the breakouts, because there's no reason to do the whole face, especially when that's the only one that's a little bit uncomfortable. Skin rejuvenation, default settings, and I use the 530. And then if I'm trying to go after more fine lines, I'm gonna go to the vascular therapy, and I'm gonna push it up just like I'm doing telangiectasia. I'm gonna use the 590 filter, and I'm gonna go up to 23, 24, but I'm gonna do that whole area, especially around their mouth where there's creping and texture issues. And then I'll go over that area again with the skin rejuvenation filter, or skin rejuvenation setting, and the 530 filter. So 590, 23, 24, and on the vascular setting, and then I'll go back and do the skin rejuvenation setting with the 530 and the default settings. Now, on the rare occasion where you want to do hair removal on somebody, then you can pull out the 690 and the 640 filters according to how coarse or dense the hair is. So I hope this helps. If you have more questions, let me know. Thanks.